Welcome to the first of several trainings for the Moving Home Minnesota MHM program. We will begin this series by introducing the supplemental services that were implemented on July 1st, 2025. Moving Home Minnesota, or MHM, is Minnesota's version of a federal program called Money Follows the Person, or MFP, Rebalancing Demonstration. This program was created by the federal government to help people move out of qualified institutions and live more independently in their communities. It is offered through the Federal Centers for Medicare and Medicaid Services, or CMS, and was created as part of the Deficit Reduction Act of 2005. MHM has three main goals. The first goal is to help people move to the community by supporting people who choose to transition from a qualified institution and live in the community, improving their quality of life and independence. The second goal is to offer supplemental services by allowing states who participate in the MFP program to develop, implement, and evaluate services that are not offered through Minnesota's Home and Community-Based, or HCBS, waiver or state plan programs. The third goal is to support tribal nations by providing tribes and tribal organizations with resources to create and maintain long-term, community-based care services for their members. To learn who is eligible to enroll in Moving Home Minnesota and how to sign up, visit the MHM manual using the links in the description section below. As of July 1st, 2025, 7 new supplemental services are available to people in the Moving Home Minnesota MHM program. To allow managed care organizations time to prepare for the launch, as required in their Seniors Managed Care contract, these 7 new services will become available to people enrolled in Minnesota Senior Health Options, MSHO, and Minnesota Senior Care Plus, MSC Plus, starting August 1st, 2025. In March 2022, the Centers for Medicare and Medicaid Services, CMS, announced updates to supplemental services under the Money Follows the Person, MFP, program. These supplemental services are one-time services that help someone move from an institution into the community, covering needs not usually covered by Medicaid. CMS made several changes. They increased how much states get reimbursed. They made the rules clearer about what these services can include. They aimed to remove barriers so more people can successfully move into the community. They also encouraged states to create new helpful services. In Minnesota, after 2 years of planning and working with CMS, Minnesota's proposal was approved on July 30th, 2024. There are several requirements for using MHM supplemental services. First and foremost, the person must choose the service, and it should match what they want and need. The services must be documented in the person's transition planning tool. There can be no spending before the person's qualified community residence is verified by DHS, unless it is for non-medical rides or records and fees while they're still looking for a place. There can be no direct payments to the person, meaning they cannot be reimbursed directly and they cannot receive cash or gift cards. These rules help make sure everything follows state and federal laws. Service authorization. Before providing MHM supplemental services, you must get approval from DHS. Here is what needs to happen first. You must get prior authorization from DHS if you are billing through fee-for-service. A service authorization or agreement must be in place. You can use the link in the description section below to learn how to request it. Do not spend any money on services until you receive the Service Authorization Letter, SAL, in your Minutes SAL mailbox. This letter tells you the service is officially approved. There are special rules for people aged 65 and older. If the person is 65 or older, enrolled in MSHO or MSC Plus, and will be using elderly waiver, EW services, the Managed Care Organization, MCO, must approve both MHM and EW services. Contact the MCO directly for their billing and approval process. For contact information, refer to the website DHS MCO Contacts for MHCP providers. For people enrolled in Special Needs Basic Care, SNBC, or Families and Children, PMAP, follow fee-for-service billing instructions. Providers must be enrolled in Minnesota Healthcare Programs, or MHCP. They must have the correct specialty codes, licenses, and service categories listed in their MHCP provider record for each service they want to provide. This must be done before offering the services. To update your record, use the MPSE portal, which is the Minnesota Provider Screening and Enrollment portal. Or, if you don't have an MPSE portal account, fill out Form DHS 6638, which is a Home and Community-Based Services Program's service request. The MPSE portal serves as the electronic version of this form. Note, you won't get paid for MHM supplemental services if your provider record doesn't show the required credentials and qualifications. Next, we will introduce the 7 new supplemental services available starting July 1st, 2025. The first new supplemental service available July 1st, 2025 is Pantry-stocking. Pantry-stocking helps people get essential food and pantry items to support their move to their qualified community residence. It includes the cost of groceries, online delivery fees, and tips. This helps keep people healthy during their move, especially if they can't get to a store right away. For example, it may be several days after transition before the person can arrange transportation to a grocery store. This service is designed to support individual choice on initial nutrition needs and is not designed to be a maintenance service. When can pantry-stocking be used? This service can begin up to 2 weeks before the person moves. It can only be used for up to 30 days in a row. It covers both pantry staples and fresh food, but it does not cover alcohol, tobacco, or edible cannabis products. There are also important limits. Pantry-stocking can only be used once per year, even if the person enrolls in the program more than once. The maximum amount allowed is $500 in a 12-month period. Note, a link to the list of common pantry items can be found in the description section below, but that list isn't final. You can include other needed items too. To bill for pantry-stocking, providers must use procedure code S9977 with modifier U6. This is a decremental service, which means the provider has a total of $500 available. Multiple claims can be submitted until the $500 is used up, or one claim can be submitted for all purchases. This service can only be used once during a 30-day period, and only once every 365 days. Note, if a transition coordinator shops for the person and wants to bill for their time, they must bill that separately under MHM Transition Coordination using code T1017 with modifier U6. Providers must also maintain receipts for all items purchased in the person's record. Records and fees. Records and fees is a service that helps pay for important documents a person might need when transitioning into the community. Up to $800 total can be used either before or after the move. This service is intended to help remove barriers and make it easier for people to successfully move and live in the community of their choosing. Each person can use up to $800 total for things like getting a state ID or driver's license, paying fees to reinstate a license, ordering a birth certificate or social security card, getting documents that prove a name change, like a marriage certificate or court order, requesting medical records, covering small costs like postage and envelopes to mail record requests, and paying expungement fees when needed for housing. Note, this service does not cover attorney or legal fees. When billing for records and fees, use code T5999 with modifier U6 for most of the items previously mentioned. The one difference is that medical records must be billed under procedure code S9981 with modifier U6. There are several key rules to keep in mind when billing for records and fees. This is a decremental service. Up to $800 total per person per year can be used. Providers can submit multiple claims or one single claim for all expenses. The limit is one 365-day period, not per enrollment. If someone enrolls more than once in a year, they still only get $800 total. There are also things not covered. This service only covers the cost of the actual records and fees. Time spent purchasing records is not included. That must be billed separately as MHM Transition Coordination using code T1017 with modifier U6. For documentation, providers must keep all receipts for anything purchased in the person's record. Our next service is the Transition Integration Fund, which is a service that covers the cost of essential items or services that support a person's move to the community and help them feel more included and independent once they're there. There is up to $5,000 total available that can be used before and after the person's transition. The items or services must meet at least one of the following requirements. They must improve the person's access and/or choice in MHM services to support their community transition, expedite the person's transition to the community, or address culturally appropriate items, services, or needs. This service must be coordinated and billed for by a registered Minnesota Healthcare Programs (MHCP) provider. The Transition Integration Fund helps people pay for items or services that make it easier to move into and settle into a new home and community. The fund can cover up to $5,000 before or after a move. Here's what it can be used for. It can be used for culturally important items, which are items that are meaningful to the person's culture, like a smudging or spiritual ceremony to bless their new home. It can be used for electronics and communication devices. The fund can pay for the item itself, not monthly bills. It can be used for large home appliances. The fund can be used for mobility devices, if not covered by Minnesota Medicaid. And it can be used for essential clothing. The fund also includes personal hygiene items. Small appliances are also covered with this fund. The fund covers specialized furniture or equipment for health or independence. This includes lift chairs or furniture that accompanies electric lift mechanisms. These are covered because the chair itself is not covered under state plan Medicaid, since it is considered furniture rather than medical equipment. Storage fees are also covered for up to 6 months, based on market rates. Storage service can begin at any time before or after the move, but will end at the conclusion of the individual's MFP participation. The person will be responsible for any storage fee costs incurred after 6 months. These supports with the Transition Integration Fund are meant to help with unique or unmet needs so people can feel more comfortable and connected in their new homes and communities. There are certain things the Transition Integration Fund does not cover, even if they seem helpful or important. It's essential to know what's not allowed so that funding is used correctly. The Transition Integration Fund does not include animals, including service animals. It does not include attorney costs or costs related to advocacy agencies. It does not include entertainment expenses such as video game consoles or games, concert tickets, theme park tickets, or sporting event tickets. It does not include experimental treatments. It does not include fees incurred by the person, including medical spend-downs, waiver obligations, and Medicaid copays. It does not include general vehicle maintenance, and it does not include room and board. A person cannot receive Transition Integration Fund services if they are currently receiving the same service through other federal, state, or locally funded programs like HCBS waivers, Medicare, or other liable third parties. The fund will also not pay for things that are part of a lease agreement or are the landlord's or homeowner's responsibility. It will not pay for ongoing monthly payments like internet, phone, cable, streaming subscriptions, long-term storage, or insurance. And finally, the fund will not cover vacation costs. Here's the list of billing codes used under the Transition Integration Fund. Mobility devices, as described in the previous slide, must be billed using procedure code K0899 with modifier U6. Personal items, like clothing or hygiene products, must be billed under procedure code S5199 with modifier U6. All other Transition Integration Fund items, like electronics, appliances, furniture, etc., must be billed under procedure code T1999 U6. Transition Integration Fund is a decremental service. This means there is one total $5,000 limit per person shared across all 3 procedure codes. Providers can submit multiple claims until they reach $5,000 or submit one claim for all items together. The fund is available once every 365 days, meaning if a person enrolls in MHM more than once in a year, the limit is $5,000 per year, not per enrollment. If a person reached the maximum amount with their first enrollment, they cannot access it a second time in that same year. The fund only pays for the cost of the items. If you need to bill for the time buying or putting together the items, use code T1017 with modifier U6, which is billed as MHM Transition Coordination. Providers must keep receipts for all items purchased and store them in the person's record. After a person has moved into the community, they can now get help paying for activities that support their community involvement and learning. This service is called the Community Education and Integration Costs. This funding can be used for activities that help someone feel more connected with others, explore new interests, or stay healthy and improve their well-being. Things that are covered include community activities such as yoga, cooking, knitting, or budgeting classes, and adult education like GED prep or language classes. It's important to note that this is only available after the person has moved. Studies have shown that if an individual is socially isolated or feeling lonely, it can put their physical and mental health at risk. These activities support personal growth, social connections, and a healthy lifestyle as part of living fully in the community. Community education and integration costs allow up to $500 per year total. This $500 limit is a one-time total per year, even if the person enrolls more than once. Providers can either submit multiple claims until the limit is reached or submit one combined claim. Use procedure code S9981 with modifier U6 for this service. The fund only pays for class or activity fees, and any time spent helping someone sign up must be billed separately as MHM Transition Coordination using code T1017 with modifier U6. Pre-transition non-medical transportation. When a person is working with a transition coordinator, they might need transportation to look for a home in the community. This service can help. It covers up to $1,500 for rides to look at new homes, transportation to take care of tasks for the move, and buying a car seat for a child MHM participant if it is needed for safety or required by law. This service helps the person plan and prepare for a successful move into the community. There are different types of transportation that can be covered. Transportation options include common carriers such as buses, taxis, light rail transit, and other commercial carriers. They also include individual drivers through community agencies and volunteer driver programs. Special transportation is available for people who, due to a physical or mental disability, are unable to use a common carrier. Ambulance transportation is an allowable form of transportation for bariatric individuals who cannot be accommodated by any other means of transportation. This support helps make sure people and their families can safely and smoothly prepare for their move into the community. This service is not available if the person already can access transportation through another source, such as the nursing home providing transportation through Medicaid state plan services. Listed here are the different billing codes for pre-transition non-medical transportation for providers to use for transportation to look for housing. Pre-transition non-medical transportation has a $1,500 total limit per year. Providers can bill by trip or by mile as long as the total stays under $1,500. Providers can submit multiple claims for separate trips or one claim for all travel costs. This funding is available once every 365 days. Even if someone enrolls in MHM more than once a year, they can only use up to $1,500 total. Only the cost of the ride or mileage is covered. If staff time is needed to set up transportation, that must be billed as MHM Transition Coordination using code T1017 with modifier U6. Pre-transition cleanup services. The cost to establish a clean, sanitary, and safe environment in a person's qualified community residence prior to their transition to the community is covered under this service. Up to $3,000 is available pre-transition. Covered services include dumpster rental or refuse disposal, extermination and pest control, limited to a reasonable number of treatments required to alleviate the pest problem, rearranging or securing household items to prevent injuries or falls, performing heavy household chores, such as securing loose rugs, washing floors, windows, and walls, and emergency cleanup to make the home habitable, such as mold treatment after water damage. This support makes sure the person is moving into a healthy and safe environment where they can start their new life with confidence. Billing codes for this service include using code S5120 with modifier U6 for 15-minute units, and also using code 5121 with modifier U6 for daily rate billing. Billed at market rate up to a $3,000 maximum. Total funding is limited to $3,000 per year. Providers can also submit one claim for all the items purchased if they choose. Providers can bill in 15-minute units or daily units for this service. Pre-transition cleanup services is also a decremental service. This means there is one total $3,000 limit and multiple claims can be billed against it until the $3,000 total is reached. This limit applies once every 365 days, even if the person enrolls more than once. Environmental modifications deposit. Sometimes a home needs changes to make it safer or easier to live in. The environmental modifications deposit covers the deposit for physical changes to a home before a person moves. Environmental modifications is a current benefit under the Moving Home Minnesota program and Minnesota's Home and Community-Based Services (HCBS) waivers. However, the deposit is unique to MHM. The environmental modifications deposit pays up to 50% of the cost, up to $10,000, and is used for physical changes to the home like ramps, grab bars, or widening doorways. This helps make the home safe, accessible, and supports independent living. What makes this unique is that it is used before the person moves. It can even be used if the person isn't on a waiver, and it does not count towards the waiver budget environmental accessibility adaptation service limitation because the person is not on a waiver at the time the service is provided. This support helps remove barriers and make sure the person's new home truly works for their needs. The environmental modifications deposit will cover necessary deposits to start modifications prior to the person moving to their qualified community residence. It will also assure adequate access to a network of providers. It will meet the needs of eligible individuals, increase equity in service delivery, and support people who do not choose to enroll or are not eligible for an HCBS waiver. These services can pay deposits on labor, materials, and the home assessment, so home modifications can start before the person returns home. These services help increase the number of environmental modification providers willing to do the work so people who need help can get it. They also help create more fairness in how services are offered across different communities. It should be noted this service does not provide a deposit on vehicle modifications. The MHM Environmental Modifications deposit must be billed using procedure code S5165 with modifier U6. This can be up to half of the cost, up to $10,000. All remaining expenses for the home modification costs must be billed under their respective service codes once the person has moved to the community. MHM environmental modifications must be billed under procedure code S5165 with modifier U6 and U1. HCBS waiver environmental accessibility adaptations, home assessment, must be billed under procedure code T1028. HCBS waiver environmental accessibility adaptations, home install, enroll be billed under procedure code S5165. To make sure home modifications go smoothly, the transition coordinator must work closely with the lead agency. What needs to be coordinated includes which EAA services the person needs to move into the community, and working with the provider to complete the work. All modifications covered by the deposit must follow the rules in CBSM Environmental Accessibility Adaptations and CBSM Guide to Home Modifications under the EAA service. The lead agency must provide the person's MinChoices support plan or other documentation, the EAA provider's name, the provider's NPI number, and the total approved cost. We want to make sure there are no gaps or breakdowns in completing the home modifications for the person. The lead agency, either the county, tribal nation, or managed care organization, should still be the driver of setting up the EAA service. Moving Home Minnesota is simply providing a monetary prepayment for the modification upfront. Thank you for learning about Moving Home Minnesota's new supplemental services. Please refer to the links in the description section below for more information about the MHM program and a list of transition services providers. You can also email our team at movinghomemn.mfp@state.mn.us if you have questions.